Dr. Beth Kassanoff Piper. I'm the incoming president of the Dallas County Medical Society. I've been talking with an increasing number of people about known COVID-19 exposures, and I hear some confusion about the best way to handle these exposures. If you have an exposure, and that means 15 minutes or more within 6 feet of someone with COVID, whether or not they have symptoms and whether or not you're wearing a mask, but if you have that kind of exposure, you should quarantine yourself for 14 days. Why that length? Because it can take up to 14 days for you to develop COVID after you've been exposed. That's called the incubation period of COVID-19. And since we know people are contagious for up to 48 hours before they develop symptoms, and that some people never even have symptoms but are still contagious, it's not sufficient to say, I feel fine, I don't need to quarantine, or I'll quarantine if I start to feel bad. What does quarantine mean exactly? It means stay in one room of your home, preferably with its own bathroom, and stay completely away from your family. Have your family bring you food on disposable plates and leave it outside the door for you to pick up after they've walked away. Don't leave the house for anything other than a COVID test or emergency medical treatment. If you have a doctor's appointment or dentist appointment or other meetings or other commitments during that 14 days, you should change those appointments to virtual appointments if possible, and if not, you need to cancel them. Please don't break your quarantine and potentially expose other people who might get severely ill. I've heard stories about families not getting their teenagers tested when they have COVID symptoms because they don't want to have to report the case to the school and don't want to self-quarantine. And I just want to implore you to not do that, please. The other teenagers in that class may have grandparents that live with them, or their parents may have cancer or diabetes or be immunosuppressed. And they should be provided with the information they need to protect themselves and their families. If you have an exposure, monitor yourself closely for symptoms and for fever, and talk to your doctor about when testing might be appropriate for you. Lots of patients say to me, I want to test now so I can be sure I'm not going to get it. Or let me go ahead and test so I don't have to quarantine. But having a negative test before the 14th day of your quarantine does not allow you to get out of quarantine early, because you could test negative today and still go on to develop COVID symptoms tomorrow and be contagious tomorrow from your exposure a week ago. This is just not anything we've ever had to deal with before, and I know it can be confusing and scary. And I know that some of the information we heard at the beginning of the pandemic is not what we're hearing now. But if you have questions, talk to your doctor. She'll be able to give you guidance. And let's continue to work together to protect each other. Thank you.